So the government has already announced a 4-week CMCO across most states in Semenanjung, Malaysia. So this will last until December 6. Added to the previous CMCO since mid-October, it will be about 2 months that some of the states have already been under CMCO. Although you have said that CMCO is the best way to balance life and livelihoods, many business owners are not getting the usual business due to the restrictions. They have to take pay cuts and some have to shut down. So do you think after December 6th, the CMCO is long enough that we should lift it up to allow more normalcy? What does it take in terms of number of cases for you to consider that this one is fine for us to remove, or we have to continue in the CMCO a bit longer? And do you think we will be able to flatten the curve in this period? Thank you.
Thank you very much. This is a new virus, so we learn every day. Each day brings new lesson to us, and see how best we can actually tackle this virus and also curb the infection. If you look into March 18, we started the MCO. It took us about 3 months to contain the virus. So, basically, so the experience that we had, so at that point of time, we were using MCO. Not only economy, all sectors be involved, and only essential services be allowed. So now we realize that, okay, we try to balance the two. Now we are allowing the economy sector to resume and continue. But we want a restriction. The most important, if everyone can cooperate with Ministry of Health and everyone can play their role, the onus is on each and every one of us to comply. If they can stay at home for 2 weeks, then we can break the chain of infection. But not everybody can comply to the compliance is a big issue now. So how do you make sure there's no cross-border, there's no cross-district, there's actually compliance to the SOP. So we have been talking about compliance from day one until today. But the issue is everyone must, in terms of collaborate with Ministry of Health and to break the chain of infection. So we are using this CMCO. Now we already probably about 2 or 3 weeks implementation of CMCO. So we are looking into it. Now we have seen positive signs. For example, the R0 from 2.2, the infectivity rate is really going down. So now we need to make sure that we can contain the infection. Basically, if we can actually break the chain of infection, then it will reduce further. So that's our strategy, but we hope that by limitation of the movement from one zone to another, for example, red zone to a green zone, or from one district to another, or from one state to another, then perhaps that's the best way to actually to contain. As long as there's a movement, there's exposure in the public to a gathering, for example, amplifying gathering, there's a risk of to get the infection. The virus is already in the community. So once the virus is already in community, we have to take all the precautions. There will be no normalcy back to normal. It's not, so that's why this is a new norm, because the virus is already in community. So we need to live with the virus. We need to adapt to this new environment to survive in terms of the practice and to prevent from the infection, from infected. So I think today, I think although the projection of the CMCO is for 4 weeks, but if we manage to flatten the curve, then it will be earlier that we go back to RMCO. That means you still have to comply to the SOP, and then we allow normal activity to resume back at that point of time. Until probably we have a solution in terms of either we hope the best that the virus mutate to a weaker form, for example. But we also worry if the virus mutate to a more aggressive, in terms of more infective and more aggressive. Obviously, the hope, and we get a vaccine. And I mean, we have the government have, Ministry of Finance already allocated 3 billion ringgit for the vaccine. So, but today we do not have the vaccine yet. So we hopefully, in time, we will have the vaccine for the solution. But in the meantime, we only have the public health intervention. And if Ministry of Health and the government cannot contain the infection if without the cooperation and collaboration from the public. So if every one of us can comply, and rest assured, we can actually bring down the curve. So we have done it before. In March 18, we started with the MCO, then we continued with the RMCO, then from the RMCO, we managed to flatten the curve to double digit, and then eventually to single digit, and we have 3 days of 0 cases. And everything was well contained in terms of managed until September 20th, and when the PRN election came in, the compliance was the issue, and we see that, you know, the flare up the infection in our community. So I think this is the lesson learned, and we hope that we can prevent a next election, because this is not the time for election, whether for PRK or even PRN or even the PRU. So the timing is just not right.